and thank you for coming. I think the interest in this topic seems to be definitely important and growing. And on behalf of the International Medical University and the Malaysian Medical Association, I welcome you to this evening CME entitled Aging and Dementia. This event is organized by the Department of Psychiatry of the IMU and the Malaysian Medical Association Negeri Sembilan branch and sponsored through Novartis Malaysia. Our speaker for tonight is no stranger to Malaysia. And in fact, he is a Malaysian, if I can say that. He comes from Batu Pahat. He did his MBBS in the University of Malaya in 1973, his MRC Psych in 1980 in the United Kingdom, MD in Singapore in 1991, and FRC Psych in 1992 in the United Kingdom. He has had postgraduate training in the Oxford University, geriatric psychiatric traineeship in Harvard University in 1984. He's been the lecturer and also now the professor at the National University of Singapore. He's also been the Vice Dean of the Faculty of Medicine of the National University of Singapore from 1996 to 1997, the CEO of the Institute of Mental Health and Woodbridge Hospital, and he also sits in as a WHO consultant for research on elderly with dementia, and is in the World Psychiatric Association Committee for Education. So I think he's a well-chosen speaker to speak to us today on aging and dementia. Prof. Kwok, please.
Thank you very much, Dr. George. I stand between you and your dinner. Last night during dinner, someone asked me, how are you involved in this research on dementia, and how do you get onto this research? And of course, during discussion, someone asked me about my background training in Oxford. In fact, I was trained as a child psychiatrist in Oxford. And when I worked in Singapore, there was a scholarship coming up, a Rockefeller scholarship, and you must have somebody in America to link up with them. And I had a friend in Harvard, and he was doing geriatric psychiatry. So I remember going to the interview, and in Singapore, and the dean interviewed me, and he told me, here in Singapore, we have a virtual totem pole, North American totem pole, Top of the pole are people that are surgeons, Second, maybe the cardiologists, Near the bottom, the psychiatrists, Not even the geriatrician, not in the list, not the totem pole, somewhere under the ground, subterranean. Why do you do such an unpopular topic, geriatric psychiatry? Well, looking back, now they realize that there was 1984, that was 23 years ago, In any kind of research, I was talking to some people in the department here, that you got to think of new areas, that no one has done before. So we went on to publish the first paper in the world on dementia in Chinese and in Malays, and the data I will discuss with you later on. I will discuss not just on the research on epidemiology, but also something on the basic science research, as some people here are very keen on basic science, and also on community care. So we hope there'll be a link between bench and bedside kind of research. I sit in the Research Council in Singapore, and every 6 months we give out almost $20 million of research. And sometimes people ask me, what's the consequence of all this money spent, the taxpayers' money, 20 million, about 450 million per year. And sometimes I tell the researchers, it must be of relevance to the doctors for seeing of patients, or we know the risk factors to talk about prevention. It's not just, some research on animal research and neuroscience, but something of relevance. Next one, please. So this will be the overview of my lecture, something on the epidemiology, something on screening instruments. Can you see the back? Is it clear at the back? All right. Something on Alzheimer's disease, something about clinical management, prevention, family support, which Philip just mentioned, very important, and a quick summary. Now, the most dramatic demographic change the world in the 21st century is the aging of the population. If from the year 2030, the aging population in Malaysia, the old people of 65, is going to multiply by almost 300%. But Singapore is going to be almost 400%. The most rapidly aging population in the world is Singapore. The second, I think, is Malawi, and third is Malaysia. So you see, it's mainly in the developing countries, or emerging nations, whereas the countries like Australia, Japan, they're already very old. So the increase will not be as phenomenal until the 50% for Japan if they move from 2030, but for Malaysia almost 300%. And if the population ages, then you find that risk factor is one risk factor is dementia. Now, to the research on dementia, and hold on for a while. This is the first study published for Chinese population is about 3%. Then somebody from Taiwan also repeated the study, about 2%. And I'm glad Dr. Payaparan is here. We're all waiting for you, and then he just arrived. Most unusual. We have both classmates, whenever in college he always come in first and he sit in front, but now he's coming late now. Second group of research, we move on, press more. There's a study done in Malaysia, Saroja, amongst the Malays, about 5%, and once again I repeat the study amongst the Malays in Singapore, about 4%. Old people above 65 years old, that's the extent. Okay. So in Rajkumar did in Chennai, Madras, about 5%. So if you eyeball the results here, you find that in fact it's about 5% or less for Asia. This is a very important finding because when we first published the first paper in Singapore in 1990, I was unable to attend the World Health meeting, and a friend, the professor of psychiatry from Liverpool, ended on present on my behalf. And there was a furor in the audience. They said, how can this chap from Singapore tell us it's 2% or 3%? Because all the textbooks in the world depended on the data by somebody from Cambridge. Sir Martin Rolfe came up with the data of 10%. Big study done in Newcastle upon Tyne. You read all the textbooks in the world, it's 10%. They asked me, so they asked, who is this upstart from Singapore? Tell us it's just 3%. It's an error in the research, So we asked to repeat, which I refused to repeat. But other people did a study, and eventually found it's true. In most countries, it's actually 5%. This is very important because if you were to plan the services for Malaysia or anywhere in the world, if you double it, then the number of cases you have is very, very big. And also in the Singapore study, we found that the prevalence for the Malays is a bit higher than in the Chinese population, because we found that the Malays, elderly, especially elderly Malay women, have a higher prevalence of diabetes and hypertension, and these are the risk factors. So some of these things are also preventable, diabetes and hypertension. Something can be done. We also found there's no difference between men and women for Alzheimer's disease, but for vascular dementia, the second form of common dementia is commoner amongst men than women. Let's move on then. All right, so when you do a big study in the community and help to develop services for the country, you've got to estimate the number of people with dementia. So I remember a few years ago, your other Minister of Health was Dr. Chua or Mr. Chua Jiming. He wanted our data, so that they can plan for Malaysia. He said from our data, the Chinese government in fact asked for the data so they can plan for China. In Singapore, we found that today there's about 7,000 cases of people with dementia. But if I ring up all the clinics in Singapore, including old people's home and various centers, we only found about 700 cases, which means that 90% of people with dementia are undetected or undiagnosed. And often they will see the doctors, especially the primary care doctors, and some of them, many generations had no lectures on geriatric medicine. So to them, maybe a bit of poor memory, or that's normal aging. Dementia is not normal aging. Okay. So we try to convince people to maybe increase in Singapore University. There are more lectures to teach the GPs on the early signs of dementia. Now, In many countries in the world, I'm sure even Australia, if you ask the doctors to help to detect dementia, we have what they call a screening instrument. Give them the questions, then if there are possible cases, then you refer to the specialist like Philip to go, or even Dr. Tayaparan to go through one more time to diagnose it. Now, the World Health 20 years ago used an instrument